All right. So we left off. Wanda, can you hand me that remote, please? There we go. Okay. So where we left off was on some waste handling, proper waste handling technique. We were, we were on page, where the heck were we?
416
416.
in the participator guide, in the facilitator guide, we were 423.
Right, gotcha. Okay, so we finished off dealing with proper trash handling, keeping it away from your body, making sure that, we're tying it in a gooseneck so we don't have leakage. And making sure we're not pressing down on it with our hands, that kind of stuff. All right, now we're gonna jump into just a touch of, got 3 or 4 more little items here within this section, and then we'll move on to section 5. So we'll talk a little bit about linen, okay? So here's a situation to, okay. So linen, we do handle linen here, obviously as part of our job, but for the most part, we handle delivery of the clean linen and then taking of the soiled linen from the soiled room back down to the soil holding in the basement. There are times when we take bags if they're full. I know I've seen all of you do it. I do it myself. If I see a bag laying in the hall on soiled linen, I'll take it and throw it in the bin. Though it's nursing's job to strip beds and to take those bags down to the soil room. You know, it's still within our job description, but it's their task that's been assigned to them. So, I never want to really draw those lines in the sand with nursing and say, we're not going to do this and you're not going to do. We have an outline for what they're supposed to do and what we're supposed to do. If you see linen bags laying on the floor, I'd rather it be in the bin in the soil room than laying out in the hallway.
Me too.
So, so once you've taken care of the waste in a room, and again, if you see the laundry hamper looks full, follow whatever procedures you work out on your floor. Sometimes we'll push it out in the hallway and then they'll take it away or whatever the case may be. Okay? So let's say you see the sheets and towels that the nurse or the aide must have used earlier in the day lying on the floor. Okay? How do you handle linen when it's in a patient room?
Because I see it every day, and I don't think the aide even knows that she's supposed to pick that up and put it in the soil linen. So when I come in the mop, I remove it.
How? How do you?
Well, I use with my gloves and my my PPE.
Always gloves, all right? You're always gonna keep it away from your body, right?
Yep, I do.
Okay. And put it into a soil linen hamper, okay? Again, much like trash, always assume that linen is contaminated. Assume that it's covered with blood and that there's needles sticking out all over the place, all right? Carefully handle it. Make sure you're not like grabbing it and pulling it close to your body or going like this to crumble it up. Keep it, bunched and keep it and get it to the bag as soon as you can.
Even the clean linen, you do it the same way?
Yeah, I mean, clean, you don't have to assume there's needles in clean linen.
I mean, but do I
because
keep
it's
it away
clean.
from my body?
You should.
I didn't know how to handle it because somebody was looking at me and I was like, did I just pick it up wrong? I mean, do I got it too close to me?
You should try to keep it away from your body. I mean, that's why they use those little carts to push it around with, so they're not like over handling it. Then you see the nurse aides with their own little individual carts, but then they, leave it sitting out.
All week, yeah.
So it should be covered at all times as well.
The cart?
Don't carry or hold linens near your body, okay? If you're gonna move soil linen especially, roll it away from your body into the middle, okay, for easy handling. And carry it away from your body, place it in the linen hamper. And if the linen hamper or the bag is too heavy, don't lift it, all right? Those hampers are on wheels for a reason. Wheel it down the hall to the bin and tie it up and leave it, again, either ask for assistance or, we'll get somebody to help put it into the bin if it's too heavy for you. Okay? And then typically we get the linen from the soiled areas in the big blue bins and we take it down to the holding area. And then it gets picked up at the end of the day by Vantage. Okay? What if we are in a patient room and the patient says, you know what, my sheets are dirty. They didn't get changed yesterday. Can you change them for me?
I done it, sorry.
Okay. How have you done it?
I didn't use gloves. gloves, I washed my hands and I cleaned,
Okay,
and I made the bed for the person.
okay.
I
Was the
got
patient in the
clean,
bed?
no, the patient was sitting outside of the bed, but the bed was disgusting. It did have stuff in there and they were tired of looking at it, she told me.
Becky, thank you for doing that, okay?
I do it a lot,
I would never tell you, no, well, I wouldn't have you do it a lot.
but
Because
I
it's not,
do it a lot.
or you shouldn't.
Because they just stopped me and asked me
But
that.
nursing should be doing that. If you're doing it that much, and I don't know what you define as a lot,
It's a
if
lot.
you're doing it that much, then nursing is taking advantage of you.
Yeah, I draw the line,
Okay,
I
thank
draw the line.
So now I'm being taken advantage of.
I'm not saying don't ever do it. We want to take care of our patients. But at the same time, if you're doing it a lot, and I don't know, again, what a lot means. Does a lot mean once a day or once a
No.
month or 5 times a day or?
Almost 3 times
Yeah.
a week.
Okay, that's too much. Nursing should be doing their job.
Cause I gotta draw the line with.
That's why I
stripping
stopped
the
coming in
rooms
on the
too, like,
weekend, because that's when they hit me, because they have no aides.
That's
So you
not,
making
it's still
bids?
Can I
not,
make
nah,
beds?
I'm making a bid.
it is nursing's
That's too
job.
much.
We make the beds after discharge and transfer cleans. Nursing makes the beds on the daily. So,
Okay,
You strip a room sometime?
yes,
I mean, I done did that sometime, cause I be wanting to get it done and they be in their own little world sometime, and if it ain't that bad, I can take the seats off and get the stuff.
yeah.
But then sometime I'll be like, I see them sitting around just
Yeah, then you
texting.
like, they can do
Yeah.
it.
If
Yeah.
you're just sitting around not doing anything, there's no
but,
reason we should.
okay, but when you
Yeah,
ask them to
wait for me to
do
do
it
it.
and then they don't even do it right. The
I'm not-
nurse
Yeah.
won't even do it right.
I mean,
That's
they leave
it.
some
How do
stuff.
you not know how to do it?
They leave some stuff.
Yeah, why?
You know,
Well,
I just
and
take
some of
it.
that, Becky and Mo and everybody here, is we take a lot of pride in our work. We take a lot of pride in what we do. We take pride in taking care of our patients. And I will never snuff that out. I will never tell you not to help a patient. However, we've got to figure out a line where they're taking advantage
Yeah,
of
cause
you.
after a while, if you keep doing it,
It becomes
they
your
gonna
fault.
keep expecting you
They
like.
are, that's why I
you
stopped coming in on Saturday
Then
and
when you
Sunday.
not
They
here,
are.
When you're not here, the people
Meanwhile,
ain't
they're
doing it.
sitting there playing, you know,
Yeah,
words
they
with
on the
friends.
phone.
Yes.
You like,
Chit
yo.
chat.
Yeah, so just don't let yourself be taken advantage of. And if you want help with us intervening, we're happy to do that
Okay.
as well. Okay.
I ain't doing
So let's talk a little bit about linen in general. So one of the things we do here at Roswell is we stock the clean linen. Okay, so every linen cart that we have in all the clean rooms has what's called a par level form. Okay, it doesn't look exactly like this, but it's similar to this.
Yeah.
And essentially, what it is it's a form. This par level form they show in the example is more for a exchange cart system, where you're delivering a set amount, and then when you come up the next day, you take the whole cart away, and you put a whole full cart in there, and then you mark down how many of each of the items was left, and it helps you control usage a little bit, and helps you really estimate your par levels properly. We don't actually do it this way at this point. We've long dreamed of switching to this type of method.
Okay.
But, right now, we're pretty much just stocking the carts that are up there, but we do have par levels. So if you look at any of our clean linen carts, you will see a little tag on
I've
there.
seen it.
And it lists each item and how many of the item is the par. And ours actually lists how many are per bundle. And that helps our guys stock them quicker. So if you're supposed to have 40 washcloths and there's 20 in a bundle, we know we can put 2 bundles on there. All right? So again, that's how we manage our linen is through par levels. Each cart has a par level, and we will stock it to the par. And then typically we'll go through, especially with blankets, because our patients being immunocompromised, being, a lot of times going through a lot of things with transfusions and things like that, they tend to be a little chilly. So we will supplement extra blankets and stuff like that, usually later in the afternoon.
Or we put them in the warmer.
Yeah,
Because we
definitely
gotta
stock the
warm
warmer, and we make sure, that's one item we try to make sure we've got plenty of. All right, so this is, again, a typical par level sheet that you might see at a hospital. Ours is
I
a
see
little
it.
bit different than this, but just, still hangs on the end of every linen cart, including clinics. The clinics all have a par level on their linen cart as well. Okay? So why do you think linen care is important?
Because of
It's going on the patient's
it's going on the
body.
patient's body, right?
Right, yeah, it literally touches the patient. It's important for them to feel comfortable in their space. They're here for a day, a week, a month, however long they happen to be here, and they're laying in that, so it's important for them to feel comfortable. What else do you think? Why else is it important to make sure that the linen is cared for appropriately?
Because of the soil, some beds being soiled and stuff like
Yeah,
that.
for infection control
This-
reasons.
yeah.
Yeah. So we want to make sure that the linen they're getting is clean, but we also want to make sure that if it's soiled, we're taking it away and that we're not giving the patient a product that's not suitable. All right. Or that could interfere with their care. Okay. And if we manage linen properly, we can actually provide cost savings, because if we're just like filling things to the rafters and stocking tons and tons and tons of linen, people tend to want to just use more of it. The more you stock, the more they're going to use. So making sure that you have good par levels, which really take into account the volume of the floor, the number of sheets, blankets, pillowcases, et cetera, used per patient, understanding like, you know, the difference between, say, a regular inpatient unit and maybe like an ICU, where they have they use a ton of pillows, they use a lot more linens because they're using it to prop people up and stuff like that. Understanding the differences between the different people that use your linen can really help you conserve and you know, make sure you're getting the biggest bang for your buck. Okay. Any questions on linens? So on your page 4.18, we just asked that question: why is linen care important? And what do we say? It's important because
it touches the patient.
it touches the patient. We want
And
the
it's
patient to feel good.
soil,
Yeah.
being soiled.
It helps reduce the spread of infection when they have clean linen. All
Helps
right, so
reduce.
from infection control perspective, helps reduce the spread of infection. And it can provide cost savings if we manage it properly.
Mhm. Cost? Do we put that down though?
Yeah,
Okay.
if we're not wasteful with our linen, we can provide cost savings. I will say that I manage the linen budget, and we always typically finish under budget on linen because we manage it pretty tightly. And even though sometimes it may seem like we have gobs and gobs of linen everywhere, we manage it fairly tightly. We do a pretty good job of understanding our linen needs. Okay, so that's a little bit about linen. Now, once you've gone through and you've cleaned the room, we've talked about how to clean a room and what to do with the linen, how to remake the bed, all that kind of good stuff. What's the last thing you typically do in a room?
Inspect.
Before that, second last thing you do in a room?
Close the door.
What's that?
Mop it out.
Mop the floor.
Yeah.
Off the floor, okay? So cleaning the floor, and again, the last thing, like Becky said, inspecting it, but within that inspection, we typically will ask the patient if there's anything else they need, right? Is
Mhm.
there anything else I can do for you? I'm taking off, I'll be back later, or I'll be around if you need me, but is there anything I can do for you now? Okay? And it's also not a bad idea to thank the patient, thank them
I
for
always
being
thank
here,
them.
thank
I
them for
thank
being
them for letting
here.
me come in.
Thanks for, exactly, that's a great
I
touch.
always say that. Thank you
As a-
for letting me come in.
That's a fantastic touch, Becky, it really is.
They really do
Yeah.
be looking for me in the morning.
So what are the steps you are going to take when you're cleaning the floor in an occupied patient room? So let's talk about the cleaning steps. You're gonna clean a floor, you're gonna mop a floor.
I'm gonna dust mop
Sweet
first.
vegetable,
Dust mop, yeah.
And,
and food, there was floor sign.
yeah, put out my floor
You're
signs,
gonna put up your floor sign,
put
yeah.
my flat mop
When do you
out.
put up your floor sign?
I put it up really when I'm ready to go in that room.
Before you start, right?
Before that mop comes out of the water,
Okay.
before you're even reaching for that mop, you should have a wet floor sign on the floor. Some people put it up right when they start cleaning the room.
I do.
I'm fine with that too. I mean,
Okay.
at least you're not gonna forget it. But definitely before you take that mop out of the
And
water.
is it okay to put the floor sign in front of the door, or do you put it on the back of the door? Because I was having, we were talking about that, and I
What do
said,
you mean by the back of the door?
the back of the door meaning where the hinges are. Do I put it there? Or do I put it right where you're trying to walk in? I put it at the back, where the hinges are.
Oh, you mean all over to the side
Like
of
the
the
Yeah.
floor?
left side or the right side?
Yeah.
I don't think it really matters, honestly.
Oh, okay, there's no rule?
Not really, no. Whatever works best for you, as long as it's there and it's visible, As
Okay.
long as it's visible for people coming towards the room to see or exiting the room. Okay, so you put up your wet floor signs, you've dust mopped the floor, and now what are you gonna do?
Get my disinfectant together.
Your mop. And what do we use in our mop water?
We just neutral solution.
Neutral floor cleaner, yeah, the QC34 neutral floor cleaner. Okay? And we are going to use that flat mop, get it together with our mop handle, and then where are we gonna start?
And the longest place, I always start by the window.
Right, back to front.
Yeah.
Start at the back and move towards the door, for sure. Okay, you start with the corner farthest from the door, and then what are we gonna do with like furniture and chairs and?
I move them.
Move it.
I move them. I move underneath because I gotta get underneath there.
Yeah.
Because the faces might change the room up, and then if you want to mop up under, you know,
Mhm.
even the bed, I tell them when they go to discharge, like move the bed, that the bed move and get, because some people won't.
Yeah,
And
They
then
would just
go
mop
move the
around
bed
it.
and bring in a special bed, and then I look at it like, oh, I gotta go in there,
yeah.
clean that floor right
Yeah.
there, because it's dirty.
Always move the bed, move the furniture, clean under the bed, moving towards the bathroom and the door. So you start in the back, moving towards that bathroom and the door, in the event that the bathroom's close to the door. Most of our rooms are, some of our rooms we have, on 8 West, some of them are like in
Mhm.
weird locations, but for the most part, our bathrooms are close to the door. It's actually some
No,
of the
they're not.
semis,
Actually, the bathrooms are
some of
always,
the semis are towards the back.
yeah.
Yes.
Mhm.
Some of
I see
them.
most of them are, because you got to walk past the bed to get to the bathroom.
Yep, you gotta walk past
The
the
ones
bed.
up towards the front, the ones in the
Yeah.
back, the bathrooms
Yeah, it's in
are.
the front, yeah,
Yeah,
the semis.
The ones in the back are close to the front, the ones in the
Yeah.
front
Yeah,
are.
the ones in, the 2 rooms in the back.
Yeah.
Those have
Bathroom,
bathrooms
you
up
hit it
front.
before you hit the bed.
Mhm.
So anyway, you're working your way towards the door of the room essentially. The last thing you mop, if you can help it, bathroom floor. Try
That's my
to,
last thing I go.
Again, it's difficult, depends on how the room is laid out. If you're mopping, you don't want to take something from the bathroom, because that's really the most possible incidence of there being blood, body fluids, urine, feces, and you don't want to pull that out into the room if you can at all help it. So that goes right along with our clean to dirty.
Some places don't even go in the bathroom, they got the little potty thing
That's
right there,
true.
they don't
Yeah.
get out the bed, so.
Yeah. You're still gonna mop it, you still wanna get it mopped,
I mean,
so
you
you
still
make sure
gotta
it's
mop it.
clean, but you're not gonna be, in that case, pulling a lot of dirt out of there. So you're gonna mop the bathroom and bathroom floor, and you're gonna, make sure everything's thoroughly mopped, corner to corner, edge to edge, in the room and the bathroom. And then when do you take away the wet floor signs?
When it's dry.
Dry.
When the floor is dry?
You can't do that beforehand, because somebody always gonna walk in.
No, absolutely. So definitely take it away after the floor is dry. So what if it's your last room of the day and you're cleaning it, you're mopping it, and then you're packing your cart up and you're getting the heck out of there? You just leave the wet floor sign there till the
No,
next day?
somebody they do it all the time, but nope, X no.
Yeah, you shouldn't.
It'll be.
No.
You shouldn't.
It'll be there until the morning.
Either make arrangements for yourself to get it out of there, yourself once the floor is dry, or make arrangements for someone to snag it.
Just gotta move it.
Yeah.
That's my pet peeve when I see that sign around. I'd be like, who did this?
Yeah, I move
Why?
it. If I walk through the hallway and I see one, it was a spill, but it's gone, I just move it to the side, and I
Yeah.
see people keep walking around it.
Yep, just
I
put
just
it up
put
in
it
your
to the side.
closet or out of sight, somewhere. Okay. Oh, you're fine. And then what do you do with your dirty mop?
Mine's I roll it up and then I put it in the
So you're
bag.
touching dirty mop now with your hands?
No, I still got on that glove.
You got gloves on
I
because.
still got on the glove.
What I
I'm
would
not finished.
recommend to you is those, and I know sometimes our Velcro on those things wears down a little bit, but there's a technique where you can actually take the mop itself, stand on a corner of it,
Yeah.
okay, lift it up,
Lift up, yeah.
and then turn the mop 90 degrees, hit it again with the stick, and then you can actually pick it up and place it in your bag
So, yeah,
Okay.
without touching it.
without touching it.
Yeah,
And I will-
really?
I will show it to you at some point on.
Okay.
But it'll save you touching it with your hand, which, even with a glove on, I don't want to be touching that dirty, gross mop. Who the heck knows? Did you pick up feces? Did you pick up, blood, body? Again, you have your gloves on, so you're protecting yourself. But the least amount you can touch that, the better off you'll be. So I'll stop up one time and just show you kind of that
Yeah,
technique.
because I want to know
If you're
that.
working in your routine, great. But the least amount you can touch dirty things after they become dirty, the better off you are.
That's what I do. I put it like he says, put it like this,
Yeah.
and I put it inside the bag, and with
And
the
use
other
the
bag,
bag?
I use the bag and I peel it.
Yeah, that's a way too. Use the bag
Yeah,
itself
use
to
the
pull it
bag,
over.
Oh, that's a good one.
That's a good one too, yeah.
And I don't touch it.
Oh,
Yeah,
I'm
with
always
clothes.
touching it.
So then once we've thrown the dirty mop into our bag, what do we do with the bag? We throw it in the garbage?
No, we bring it downstairs, we bring it down.
Can we throw it just in a linen bin? Just in a regular
No,
bin?
you can't put that in the
Okay.
room.
Yeah, if they go in the linen bin, we'll never see them again. They go out to Erie, Pennsylvania, and we'll never see them again. So, yeah, definitely bring it down here so we can launder them. The managers love washing mops for you. It's their favorite thing to do. Okay. All right. So what do you do if you see a scuff mark or divot in the floor that you cannot remove?
I do, I can remove it because your sneaker, at the bottom of your sneaker, you just keep going, you can get that mark off.
Yeah, most times, yeah.
Yeah, not all the time.
Let her know your management.
You can, you let your manager know, there might be something we can do.
You gotta-
You can
Sometimes you get
try
that magic eraser.
a different
Yeah,
scrubby
you
pen.
can use the magic eraser, it'll take it off
Try
too.
magic eraser
With
for a
that
lot of
green
things.
pad, just, but you gotta go lightly.
Yeah, I use the green pad too sometimes, if it's too,
You'll scrape all the, the stuff off. the
Yeah, we've
top.
got a lot of different tools to try, and if it gets to a point where it's just not gonna help us at all, then we're just gonna have to schedule refinishing of the floor. All right, but yeah, we'll try, probably start with magic eraser and then working our way up to more aggressive things until we can get rid of it. Okay? All right. Oops. All right, here's kind of a little, what do you do? Okay, on page 4.2. You're almost finished with the floor. When your phone rings, what do you do?
the phone
How do
rings.
you handle calls while you're working? So if you're working and you're mopping the floor and your phone rings, what do you do?
Mine's just gonna keep ringing until I
Keep
finish.
mopping.
You finish the job you're working on?
Yeah, mine's I don't play that.
Okay.
Yeah, I don't.
Yeah, mine's just have to ring until I'm
And
done.
I see people walking.
I got an answer machine on it.
They might be doing a floor machine. Or you know what I mean, they might have a linen and walk
Yeah.
in. I'm like, yo, how y'all doing that, bro? That's how they do it.
Yeah, I mean, I think our process here is, I mean, we used to just absolutely positively forbid cell phones. Like, you can't have them, you can't touch them. If I see it with you in your hand, you're gonna be
Mhm.
written up, and
Yeah.
we've kind of eased off of that on purpose. And we actually wrote into our uniform policy the fact that, you know, you can use your cell phone for business needs and for emergencies. You shouldn't be sitting there on FaceTime or on YouTube watching videos while you're working on your phone. But if you need to call your manager or your manager needs to call you, you have an emergency, some situation happen, you know, we want you to be able to, you know, life happens. We want you to be able to take care of that. But in this case, the manager calls you, continue working, get your floor done, and then call your manager back, okay? What do you think, would there be a difference, do you think, if it was an occupied room versus a unoccupied room? How would you handle a phone call at work in
Probably
an
if ain't
occupied
nobody-
room versus unoccupied?
If ain't nobody in there, they'll just clean it, they probably gonna answer you.
Right, but let's say, okay, so the manager calls and you're gonna answer the phone. What would you do differently if it was an empty, like a discharge room versus you're in this room and a patient's in there? How are you gonna answer your phone differently?
The patient was in there, was the manager calling, was the answer calling,
Well, I wouldn't
I
be
would-
talking
I
in front of the patient.
suggest that you step out. Yeah, you step out the room,
Precisely,
yeah.
precisely.
Because that's like, you know.
Yeah.
trying to
It's
do-
disrespect.
Oh,
Yeah.
Blah, 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 and they
Exactly,
like,
exactly. Just finish what you're doing in the room, step out and call your manager back or answer the phone after you've gotten out of the room. All right, don't stand there and have conversations in front of the patient. They got a lot going on, they're fighting for their life, and they don't need to hear about us and our trivial stuff that's going on. All right, so yeah, definitely don't take calls in front of the patient,
Mhm.
all right? And you can see some of the steps, you know, listed there in 4.2.
Mhm.
Okay, some patient rooms might have equipment that's affected by the use of cell
Yes.
phones. Not so much anymore, but, you know, so a lot of that stuff's on Wi-Fi now, and I guess it could be. Don't take calls in front of a patient. It says unless they are work calls, I would tell you, even a work call, like step out of the room or, you know, close the door or whatever. Do whatever you gotta do to shield that patient from having to hear you have your conversation. You know, you can let the patient know your manager's calling. My manager's calling me. I just have to step away for a minute. I'll be right back.
Mhm.
If you think it's something you need to take.
Okay.
You always answer the phone politely, all right? That's something that I think, you know, sometimes we have it here and sometimes we don't have phone etiquette. But I think this group's pretty good about always being polite on the phone. And if possible, let the other party know you're in a patient room and that you'll return their call, okay? So again, if you absolutely can't just finish the work and get out, Just, either you can click that little button that says, may I call you later? A lot of times when you, on our phones now, you click that button that says, may I call you later? It sends them a text message. So just do that,
Okay.
just to get the phone to stop ringing and make sure that they know you're gonna call them back. All right, so really proper phone etiquette is the key there. All right, well, let's review what we've talked about, okay? In a contact, and this is on your page 4.21, let's write these down. Okay, 4.21 in your book.
Contact isolation room.
So, in a contact isolation room, what PPE is needed?
The gloves and the, gown.
Gloves and gown. What should you always do before opening a door?
Knock.
And then what, knock and then what? Just knock and walk in?
Knock and introduce yourself.
Right, introduce yourself and usually wait for an answer. Like wait to hear if they say something.
Yeah.
Don't just like knock as you're walking in and just keep walking, Knock, introduce yourself and wait for them to say, oh, okay, come on in, or, get the heck out of here, don't ever come back, whatever they're gonna say. But give them an opportunity to answer, okay? So what was the first step in cleaning the room? Okay, what was the first thing we do? when we
Wash our
clean a room?
hands.
Yeah, even before that, what are we gonna have when we go into any room? We talked
Gloves.
about this over and all. It's called having what? Having,
Our supplies and stuff.
all of that is included in having what? A standardized,
Standard, what you call it?
Routine.
routine or process, or plan. Have a plan, I'm going in, I'm gonna do this, I'm gonna do this, I'm gonna do that. I'm gonna go clockwise or counterclockwise, clean to dirty, top to bottom, wipe in one direction. Okay, so you're always gonna have a plan going in, all right? So the answer is make a plan.
Mhm.
Name 3 high-touch items in a room. And we got the poster over there that shows them. Name 3.
Phone.
Doorknob,
Yeah? Phone, door handle,
and the light switch.
light switch. There's a whole bunch of them stickered up there. Chair handles, bedside rail, overbed table, IV pole, bedside stand, all high-touch items.
Mhm.
Okay? What key information besides needing PPE did you learn from the door sign? So let's say one of these door signs, besides the PPE, what have we learned from this?
What is the,
What it is, like, droplet, what you call them again?
Either learn the title of it, yeah,
Yeah.
or the type of isolation. What else did you learn though, as far as, you definitely learned, okay, I gotta wear a mask, that's required. What else did you learn from this?
wash your hands.
Wash your hands, and also you can use either soap and water or hand sanitizer. So say with the other sign, like the Contact Plus, you have to use soap and water. Okay, so the type of, what you learn is,
Type of isolation it is and, type of like what's the type.
sometimes you'll also see on some of these signs, though, they won't really know them on our signs here, they have a separate sign. But there may be a sign up there that will indicate if the patient's a fall risk or those kind of things.
You see the little yellow stickers on the
Yeah,
front of
see
the
the
door?
yellow sticker. They don't typically put that on the isolation sign though.
But you said on the test, they don't use Contact Plus on it.
No, they don't.
So they'll just say contact room, or
Contact
like
room
MRSA
or
or
drop.
something.
Yeah.
So we don't have to wash our hands, we can still sterilize them, but using the Perel, we don't have to, only Contact Plus, we wash.
Or say C. diff, they might say C. diff
They
on
might
the
say C.
exam.
diff.
Contact Plus is soap and water.
Mhm.
But if they don't call out Contact Plus, I wouldn't worry.
Don't worry about it?
They're probably not gonna ask you about soap and water, but they may just say C. diff. And we know that C. diff, we have to use soap and water.
Okay.
So if your phone rings, what do?
Step out of the room.
If you can step out of the room, if you can just let the patient know, I'll be right back, I'm just stepping out for a minute, it's my manager. But yeah, practice good phone etiquette, basically, okay? Step out to answer or silence the phone and continue working. Okay, how do you restock missing paper towels?
You take your own gloves off.
Mm-hmm.
And wash your hands
Yeah.
and start again with some new towels.
Okay, perfect. who can demonstrate, oh, we already saw, you guys already demonstrated how to remove gloves, right?
Yeah.
Okay, we did that. Okay, that concludes module 4.
Woo-hoo.
And we're gonna start right in to module 5, half of which is review of modules we've seen before. So because we've been rolling right along, we can kind of move through that pretty quickly. So the learning objectives are for module 5 are going to be to understand how to perform discharge cleaning, determining the right cleaning solutions, tools, and techniques, explain how to clean a standard bed, explain how to handle clean and dirty linen, make a bed according to facility standards, recognize technicians' role in infection prevention and control as part of the patient care team, properly don and doff personal protective equipment, summarize how to stay safe as an environmental services technician, discuss how to keep patients safe, offer good customer service to all patients and staff, and demonstrate ethical behavior at all times and report unethical behavior. All right, so those are the things we hope to glean from this. And again, to Felicia's point earlier, you notice a lot of those things are very similar to the stuff we've learned already, because a lot of this rings true. We try to get repetition. We try to do things the same way every time. So if we're trying to do things the same way every time, we obviously want to teach things the same way over and over, okay? So we're gonna go through discharge cleaning process. It's gonna take about 45 minutes. Cleaning and linen safety is gonna take about probably 15 to 20 minutes. Ethics and safety is gonna take about probably 15 minutes. And then knowledge check will be 5 or 10 minutes, and then we should be wrapped up for the day. Okay?
Okay.
All right, so we're gonna do a quick little review of the last session. Why do we read signs on the door?
So we know what people need to wear when we're going in the room.
Yeah, and some other information that we can get from those
Get
signs.
some them signs, yeah.
Okay, why do you practice proper hand hygiene?
So we just stop the spread of infection.
Yeah.
Perfect, Becky.
I'm getting there, ain't it?
You go. How do you select the proper PPE?
By the picture of what it says on
And what's on the sign? What's on the sign, which indicates the type of precaution or the type of insulation. Yeah. Okay, and then we know how we're gonna clean a room to have a plan. What's our plan in going
Does
into
it have
the
a
room?
routine?
We're gonna have a routine, have a plan. Clockwise or counterclockwise, clean to dirty, high to low, unilateral wiping, okay? Okay, we just did that, and we've already reviewed all that stuff, so we're not gonna do it again. Okay, next section, section 5. We just did review, and we're moving into now module 5, working our way around this little mythical room into unoccupied or discharge cleaning, all right? So now that we've kind of walked through cleaning an occupied patient room with introducing ourselves and all the things that are kind of special to an occupied room, we're going to talk about a discharge room. Okay, this is going to be about cleaning, discharge, and transfer room, and we're going to discuss items that need additional attention in a discharge room. Okay.
Okay.
All right. So, do that. Let's get to page. You're going to be on page 5.4.
Easy.
Okay. So-
Yeah, they're in
What's the
bed.
difference? No.
The pictures of these are up on the.
What's the difference?
Oh, yes.
What's the differences between occupied and discharge cleaning? What's one big difference?
One's occupied and one.
Patients in the room.
Yeah.
Right, so, okay, write that down under your question. What's one big difference? Patients in the room in the one. What else is in the room? In the occupied room?
The tray,
And something.
trash.
And something on the floor, you see from.
Yeah, and
Spills.
what else is in the room on the one on the left, the occupied room?
What else is it?
I can see one thing that's sitting on the overbed table that isn't in.
A tray.
What else?
Family, passion belonging.
Yeah, personal belongings.
Personal belongings.
So you definitely in a discharge room, you shouldn't see personal belongings. I know sometimes they leave them behind. But we should always be kind of on the lookout for that stuff and make sure that we're not throwing out people's personal belongings.
Right.
Okay, so why does this matter to us, an occupied room versus unoccupied?
Because one is gonna be clean with a person in it and the other one's gonna be clean without.
Right, and there's some things, there's some tasks that we'll do in one that we won't do in the
in
other,
the other.
like high dusting, that's an
Yeah.
example of one.
Right, we can't even get over the light.
So we're gonna look at a list of tasks and you decide or tell me when those tasks are done, okay? Occupied,
Go ahead.
unoccupied. So remove all soil linens.
Remove all soil in it is unoccupied.
Right. And
Unoccupied.
again, we talked about that. That's
Yeah.
typically nursing's job to strip the bed here, but not everywhere. I've been in hospitals where we strip and wash and nursing makes the bed. Like, so that's kind of facility specific, but removing all the linens by someone before the room is cleaned for discharge is definitely an unoccupied room.
Right.
Perform hand hygiene.
They're still in the
Wait,
unoccupied room.
Guys, turn to 5.5 so you can, yeah,
Yeah,
so you can
on
just,
5.5.
Oh,
these are all there.
yeah.
and then you can underline the answer.
Oh,
Yeah, so number one, remove all soil linens. Is it occupied, unoccupied, or both?
unoccupied.
Yeah, I mean, you're gonna, if you have a full linen bin in an occupied room, you're gonna remove it, but typically there are soil linens that still are in the room if they have a bin in the room. So yeah, it's gonna be unoccupied.
Both.
What's that?
Both.
Does it say both?
Just say remove all soil linen.
Yeah.
And both,
For linen,
Hang on, I don't have the answers.
because the nurse is
Where'd
supposed
you
to
get
do
the
it
answer?
I don't know, I
anyway.
got them, we wrote them down somewhere.
Okay,
So.
I mean, I don't know, to me,
What is
unoccupied, if you have an occupied room, there's soil linen in that room,
Mhm.
patient's laying on it.
Yeah, or like in the bathroom. You
Yeah,
know, you might have a toilet
so I don't know
towel,
why, we-
washcloth.
I don't know why we'd say both today.
Well, but just.
I would say we're removing it. and
So it's unoccupied.
Sometimes they have towels and stuff on the
Yeah,
sink,
no,
but I don't know if they still use
But
them, I don't wanna take them.
Both? Use both?
Well,
I would
guess
say
it depends.
unoccupied to me, but, I mean, you're gonna have soil linen in an occupied room.
Okay.
Patient's laying on a bed full of soil linen.
All right.
Once they lay on it, it's soil. Perform hand hygiene.
Both.
Definitely.
Yes.
Perform high dusting.
Occupied.
Unoccupied.
Unoccupied, yeah, because you can't just.
Oh,
You can have high dusting over a patient, right. Only unoccupied. Leave environmental services calling card.
What you mean by
Because
So we have
used to
those
do
little
that.
while you're out notes, or we have little
That's what-
business cards or
while
things
you
we
were out.
can
That's an
do.
occupied room, just to let the person know
that?
when they come back
Do that?
from wherever they got their test.
You could do
Just to
both.
let them know.
You could do both if you want to give them a little note. We have those notes that have your number on it. If you want to do that, you're welcome to do that. Most people will put that in a room that's unoccupied,
Unoccupied.
just to let them know that you cleaned it while they were gone. But that's, I mean, that to me would be up to you. If you want to give someone a calling card while while it's occupied and introduce yourself with it, you're welcome to do that. Greet patient. Occupied, yeah, there's no one to greet if it's unoccupied. You're talking to yourself. People look at you funny. Clean restroom last. Oh, yeah, you're always going clean to dirty.
Yeah.
Look for infection control signs.
Occupied.
No.
Oh, yeah, because it might have been a COVID, you know.
Yeah, it
COVID.
could have been a discharge, and it's an airborne droplet or contact. And you want to know that going in, so you're using the right PPE, even if it's unoccupied.
Yeah.
Okay, number 8, dust curtain rods, tops of doors, recessed lighting. That sounds a lot like high dusting to me.
Yes, and that's an unoccupied, unoccupied,
Sure.
Unoccupied.
because I do that. I do the blinds
wouldn't
and
you
I do
say?
the curtains.
Yeah,
and
It's
I would say
unoccupied.
I do dust
Yeah.
all that.
Okay, wipe down TV remote and nurse call device.
Both?
You could have a both.
Yeah, I would say both.
Yeah,
Yeah.
I do it. I do it every day.
That's a high touch service. You can wipe when the
I'm not
patient's in
watching
there.
TV, yeah. Yeah, I guess so. Sometimes I do that.
Turn down mattress, wipe bed frame and mattress.
Oh, that's unoccupied.
Right, that's unoccupied. You're not gonna, oh, excuse me, sir, and like.
Can you
flip
get
the
up,
mattress.
can you get up while flip the mattress over?
Yeah,
Yes.
it's gonna be hard to do with a patient.
But we don't, when the patient in the bed, we don't wipe the rails of the bed.
Yeah, you do.
Yeah, they can.
I thought I
Anything they
seen
touch.
somewhere they said you can't.
Yeah, someone else said that too. They said that we shouldn't be
Going
doing,
into your daily,
yeah,
and then I thought it said you shouldn't be.
you shouldn't be doing that because of the fumes.
You shouldn't wipe the rails or
If
something.
something they touch, you can wipe them.
All right. I was-
Anything
I
they
thought I
touch,
seen
you can
somewhere
wipe them.
said, oh.
Even while they're in the bed, they're saying.
Yeah.
I wouldn't go like doing up underneath the mattress or anything that's gonna move them around. But if you need to wipe the top of the rail or where they're touching, you can definitely disinfect that. There's nothing wrong with that.
Okay.
It's a high touch surface. Anything anyone's touching, especially nurses come in and they lean on it, and doctors touch it. And, you know, anything that can be touched, I would say we wipe down.
Okay.
Look for opportunities to start a conversation.
That's in the occupied room, 'cause I got.
Well, again, you might still be talking to yourself again. Yeah. We're in there having a conversation, nobody else is there, someone's gonna think we're a little cuckoo.
Mhm.
Leave cart in the hallway,
Yes.
right, both,
Yes.
that's for both. Okay. All right, so let's see what the list is. So leave EBS calling card, greet patient, and look for opportunity to start a conversation occupied. High dusting, curtain rod, stop recess lighting non-occupied, turn down mattress, white bed frame, and mattress. See, here's where where we got the both from.
Yeah, okay, I don't remember.
I know you didn't, we didn't just make it up.
Yeah.
Remove soil linen. Again, I think what it asked was remove all soil linen.
Oh.
See, the question on the page before says remove all soil linen
Mhm.
versus this just says remove soil linen.
Yeah.
Well, yeah, we're gonna remove soil linen, but we don't always remove all of it when it's occupied, so I think that's just a weird way to write this, but anyway, we get the gist of
So
it.
that's why it was both?
That's why they considered it both, yeah. So, perform hand hygiene, clean restroom last, look for infection control signs, leave cart in the hallway, and wipe down TV room and nurse call the voice for both.
Mhm.
Okay,
Mhm.
so with that, let's flip to your page 5.6.
Mhm.
And yeah, and I'll tell you, even in the facilitator guide for these, which ones we do, it says, are there any tasks that you disagree with? And it says, let's respond appropriately, let's talk through some of these. So I guess they get the idea that like things could be a little gray. Everything's not exactly black and white. You know, there's some things like remove soil linen. We're gonna remove some of it, but if the patient's laying in the bed, we're not like ripping the sheets out from underneath them, you know? So, you know, there's a little bit of gray area in there.
Okay.
Okay, so, as we do in occupied rooms, it's important that we follow a logical pattern when cleaning a discharge room. Okay, so we want, again, similar to what we discussed before, have a plan, you know? Cleaning is not haphazard. We want to have a defined process. We're gonna go counterclockwise or clockwise so that we don't miss things, right? And following a set process helps ensure that we don't skip it or that we're doing things in a methodical manner. All
Right.
right, so let's fill out our thing on 5.6. Cleaning is not haphazard. Haphazard, they say. So haphazard.
Haphazard?
Haphazard, it means just like kind of disheveled and not very organized.
Okay.
Or like accidental. I accidentally cleaned everything. Choose what? Or what? Counter or
Or
clockwise.
clockwise.
So cleaning is performed in a methodical manner. Following a set process helps to ensure items do not get skipped, and it reduces the risk of. What does it reduce the risk of? Following a set of processes.
Yeah.
What's that?
Infection.
Infection or cross-contamination.
Cross-contamination.
That's what I'm looking for.
Reduces the risk of cross-contamination. So why are we gonna clean from top to bottom? Any dust or debris lodged from,
The top
yeah,
can fall down to the bottom.
right, from the top or the high surface. Cleaning naturally falls down to the lower or the bottom surfaces. Okay, low to high cleaning, so let's say we started at the floor and worked our way to the ceiling, that would what? Increase the risk, right, to recontaminate. Increases the risk to recontaminate surfaces, so increased is your word there.
Oh, okay.
Low to high cleaning increases risk.
Increases first. Okay.
Okay?
Mhm.
And then how do you progress from clean to dirty?
How do we progress?
Okay, using a clean, what they're gonna say microfiber wiper, but we can
We're
just say,
gonna say wipes,
we're just gonna say, yeah, a clean
proxy wipes?
Disposable.
disposable
Oh,
wiper.
that use dispose?
Yeah, or you could say peroxide wiper. I mean, you know what you're saying. A clean microfiber cloth, they're saying, or a cleaner disinfectant wipe. Okay?
Okay.
Or properly saturated cleaner disinfectant wipe. Wipe high touch areas in the room, again, following a logical pattern to avoid duplication or missing items. Clean what last? Yes. Clean restrooms last. Okay. So some tips for handling soiled linen, because, obviously, like we said, it's nursing's role here to strip the bed and get rid of the linen. However, it's still within our job description. It is something still we are able to do. Okay, on page 5.7 in your guide. Okay. We're gonna avoid what? Avoid what? Getting what from the linen?
The body.
Yeah, avoid contamination. We don't want
Contamination.
to get the gunk on us, Keep it on the linen. We don't want to get contaminated by touching the linen or having it touch our body or our clothing. Okay? Do not be aware of what that might be left in the linen.
Sharps,
Yeah,
anything.
objects, could be
Objects.
sharps, could be cell
Cell
phones,
phone.
teeth, like people lose everything in that linen.
Yeah.
Cell phones, whatever. What was the rings, all kinds of stuff.
Beware of personal,
Yeah,
when we say
any
personal items.
Yep.
Mhm.
And then we're gonna avoid what from items that could be left in the linens?
Sharps,
Yeah, sharps, but what can sharps do?
it could stick us.
Yeah, avoid getting stuck or injured. Avoid injury
Avoid
from items
injury.
left in the linen. Yeah, avoid injury. Okay, let's talk about the cleaning steps in cleaning a bed. You guys are all very thorough with cleaning your beds, so this is definitely a review for you. But you're gonna wipe down your headboard, your footboard, your side rails, nurse call device and cord, TV remote. You're gonna lift off the headboard and footboard and clean the exposed area. Clean and disinfect the handrails, ensure all tape is removed. Clean the mattress with the disinfectant solution or the wiper.
Mhm.
Report mattress holes or tears. Those, nursing owns the mattresses, so if we're gonna report those, you see a mattress that's ripped or torn, report that to the nurse manager on the floor, because they need to get that switched out. Or we'll switch it out, but they need to call us and they need to account for the fact that they have a ripped mattress. All right,
What do
so
we do with pillows?
what do you mean?
When I see a tore pillow, like it's torn,
It's torn, just throw it away.
we don't save them?
Mm-mm.
Not if it's torn. No.
No.
If it's
Don't
that worn
tape
out
it, don't
torn,
tape it.
No.
just throw it away. We buy the pillows, that's part of our department.
Okay, just throw it
And I
out.
would just assume buy.
And blood, what about blood on there? And the blood won't come out?
We try to clean it, and if it's saturated with blood, then you throw it away.
That goes in the garbage too?
If
Okay.
it's saturated with blood, if it's to the point where it's dripping with blood, you put it in a red bag. If it's just got a blood stain on it and it's not dripping, and you've wiped it and tried to wipe it and it just is stained, then
Mhm.
just throw it in regular trash.
Okay.
Okay? Okay. You're gonna clean the overbed table thoroughly, inside and out, including the bottom where nurses like to stand on the bottom with their feet.
Mhm.
You're gonna clean desktops, phones, door handles, and other high-touch areas. If applicable, you're gonna clean the blood pressure cup and tubing. Some areas have those still. Most of them, they have the little portable units they go around with, so they don't really all have those blood pressure cups on the wall anymore like they used to. Check the privacy curtains. So in our inpatient areas, we've gone to disposable privacy curtains, which we switch out at, every 3 months or after isolations. So if you have an isolation, call your manager, let them know so we can get the curtain changed. All right. But check the privacy curtains. Hopefully we can stay with.
What are we
those.
looking for on a private, what are we looking for?
Well, look for
Besides
stains.
blood,
Yeah, blood,
stains?
blood, anything that's been splattered or splashed down there. Usually body fluids and stuff like that is what we're looking for, especially with the disposable ones. I mean, we're just gonna change them. If we need to change them, we'll change them. We're not gonna play around like, oh, that might be a stain or it might just be permanent. We'll just change them if they need to be changed, okay? That's privacy curtains, remove gloves, perform hand hygiene, and remake the bed. So obviously, you're gonna take your gloves off, wash your hands before you go make a bed with clean linen when you have your dirty gloves on. Okay, so next thing is this little ditty.
Oh, we should talk about specialty beds, what you do with those.
Yeah.
Okay, now, especially the Hillrom.
Yeah.
They got a plastic bag underneath there. All people gotta do is lift up that mattress, clean the mattress off. I just wipe
Yeah.
it down. And then I put the plastic bag. The man told me, do nothing else. If you just wanna wipe down the bed, just wipe it down, but do not clean my bed. He told me. He said, just wipe it down and throw that thing on top.
You're right.
He said, put it on top.
That's exactly right. And then they come and pick them up.
Yeah.
Yeah, that's
Thank you.
exactly right, precisely. It's funny, I just got a copy of the draft policy from Melissa.
Oh, really?
On moving of beds and what to do with specialty beds. Can you guys pass me those cards down? Here.
People
Okay,
gotta make sure when they're training people, they tell them about the specialty beds, 'cause
Yes,
They'll leave them in there.
they make 'em up.
yes,
And then I
yes,
come
they
in and be
will.
like, "Mo, that bed made up, can you get it out? We need a regular." And they made up a special
Yeah,
bed.
and then
I'm
we
like,
just
who made up a
wasted
special bed?
Yeah, but how do you not know that?
That's what I'm saying.
Yeah.
like,
well, some people aren't observant to that, and you guys have been here a while, you know what our actual beds look like versus our specialty beds. So, I mean, in your role as a trainer, that might be something to make sure you highlight. Remember to highlight that when you train someone, like, hey, see this bed here? This is a specialty bed, we're not, you know, when that gets done, we wipe the mattress off, we pull the blue plastic sheet up over the top and shove it out in the hallway.
And then we have the ISO air,
Mhm.
so we can't keep those in the room either unless the nurse asks for them, the doctor orders
They're
it.
supposed to.
Or are they a regular bed? Cause that's confusing.
They're a Roswell owned bed, but they're a
So,
special mattress. So the answer is they like to know where they are because there are some patients that need to have them, but every patient doesn't need to have them. So.
So they can stay in the room?
Well, technically, yes, but as long as we know that they're there. They're working on a process now to better identify where those beds are, because we shove them in a room, the patient stays there, and it might stay in a room for forever because it never gets pulled out.
never get pulled
But-
out.
They need those for certain patients with certain types of skin conditions, or they could get bed sores and stuff like that. So, yeah, they're working on a kind of a new way to
Because
track
the
that a little bit.
one nurse, I said, we gotta get that bed moved, you gotta call down and get the bed removed. She said, no, I don't, it's a regular bed. I go, no, it's ISO air, we can't have it, but so we could have it.
Whatever they say, I'll be like, whatever. They say it's cool. and
Maybe
I'll
they
leave.
needed it for the next patient coming in.
Yeah, I don't
It's
want to know.
possible.
I mean, we don't really question nursing, because
Yeah.
they're the ones who are supposed to know. So it's not really up to us.
I do, I argue with them because,
It's
well, I
not
never
really up
mean
to
to
us what
argue
bed
with
they
them.
have, but you're right in that those are specialty beds
Mhm.
that we're always looking for.
I
So if we
thought
have
so.
another bed to replace it with, we should be trying to do that. Should be trying to.
And then on Dorothy floor, the beds is different from on my
Yes.
floor.
Yes,
You
they
know,
are.
so, like,
And an
So I could be
ICU.
training somebody there, she train them up there, and it's gonna be
It's a little
different training
different.
because they don't,
It's a little
you
different
know, the
bed.
bed making is
Yeah,
different.
they're
So,
ISO beds, all of them. And
her
hers.
beds don't, the mattress don't flip up.
Yeah,
You know, it's stuck to the thing, so.
yeah, you can't even wipe
Because it's
underneath.
got the hoses on it. It's got the
Right.
tubes, the tubes.
Yeah, what happens when you don't get underneath those mattresses?
Well, we do it as much as we can, as much as we can get at, and after, eventually they get PM'd every so often, they'll take those and do preventative maintenance on them, and when they do that, they take them completely apart.
Oh,
Those two
okay.
beds.
So they do get it.
Yeah, they do. All right, so. Again, the major differences really, for a discharge clean versus a occupied room clean are what? What would we consider the major differences?
The difference is the patient being in there.
Yeah, that's a major difference, yeah. What else? What's a major difference? Something we absolutely don't do in an occupied room that we do.
High dust.
High dust, yeah, exactly. High dust completely. It's sure, especially like the back of the TV where it attracts all that dust, make sure we're getting that
Mhm.
at discharge. The other thing is the bed itself, you know? Well, during occupied patient room, we might do a quick wipe of the handrails because people touch it, but we're not really going on that bed top to bottom. Versus, you know, an occupied or an unoccupied room where we're going all over that bed top to bottom. Okay? So the detail with which we clean the bed and the fact that we're making the bed is a big difference. Okay? Okay. So, we got a new sign up here. Says, what needs to be cleaned? All right, so we're gonna do our little dot thing again. There you go. You can start, Sharita. And pick out 2 things that need to be cleaned in this room. It's an unoccupied room. So let's imagine that nursing has stripped the bed. And it's ready there for us to do as a
Even though
discharge.
it's unoccupied, but everything needs to be clean,
Yeah.
everything.
Okay, well, there's 2 things.
Table, everything, just 2 things? Okay.
Yeah.
And now there it is too, I want to get that. I finally see it, look.
The call button.
Yeah, what they use for the TV, because they definitely touched that. Everything needs to be clean,
Ah, is that a window?
Yeah, sometimes you wanna clean the window if you dirty.
Blind?
Line.
Oh, okay, all right.
yeah.
I was like, what?
Sometimes you gotta clean the
Yeah, we
window.
clean.
I mean, I do the
Yeah,
inside,
we don't make
for
you
the
go out there.
fingers.
Yeah, we'll spot clean. We can't
Yes,
find
it's
all
a
of
spot
it.
clean,
Yeah.
that's what I'm,
Fingerprints.
yeah, that's what I'm thinking. That's why when she said, I said, clean it.
Everything needs to be clean.
Okay, everything needs to be clean.
Because it's a discharge,
Pick 2.
they touch just about everything.
I clean walls,
Light
but I don't
switches,
know.
Well, that's
everything.
why when you train the people, do you tell them
I
sometimes about the
can
wall?
clean the wall.
Yeah,
Like in the
So am I
bathroom with the
supposed to?
splatters?
Yeah.
Yeah, I'm just saying.
absolutely.
Yeah, that part. 'Cause they touch everything.
Yeah, they touch everything.
Yep, they touch
That's the bed.
it. Don't wanna stay on.
You already got one on the bed.
No, that part, that thing right
I mean,
there.
that's the whole bed. One is for
I'm
one
not even for the whole bed.
Nope.
That's what's confusing us. You
bed. I mean,
saying
you
stuff
clean the
like
whole
that?
bed, the whole bed need clean.
Yeah.
Yeah.
So all you
so
gotta
put
do
it
is
on
put
there.
one
Well,
orange
there's
one on.
person, there's the mattress, there's the headboard, there's the
Yeah.
footboard, there's the bed
That's
rail,
what they want.
there's the bed
Individual
frame.
items, not just,
Oh, yeah, there you go. Floor.
Oh,
Oh, yeah. Okay.
okay.
Take us home, Kapil.
Let's take us home.
Use all of them.
Yeah, you
Everything really
he works in OR, he knows exactly what it needs.
Yeah.
Ah.
Yeah.
Oh, yes, I like that. I do those
He
too.
said he.
Yeah.
Pull, yeah.
Yeah.
Okay. All right, so let's go with the dots.
We
Let's
clean
take
our-
some-
I heard somebody said the nurses clean the ivy pole. I mean, how we usually clean it, but
They clean the brains,
The
right?
brains,
The
yes.
brains of the thing.
what you mean, oh, the top of it?
The
machine?
exchanges where the
The
big.
The inside, where everything
The
goes.
thing that plugs into the.
We
They don't
clean
clean the
outside.
bottom, man. I don't know.
No, we
we
clean
clean
the
the
bottom.
doors open, so I thought we just,
We got a pole.
yeah, the bottom, especially the bottom of it.
So there's a couple things on here that didn't get tagged. Can you see any that
Yeah.
didn't get tagged?
The bed.
No, see
The
what they
mattress
The mattress.
Right, the
garbage
mattress
can.
itself, the garbage can.
and the
Then
pillow.
they get tagged.
Yeah,
do. The wall up there with all the stuff on there.
yeah, there's a vent in the wall. You see the
Right
wall
there.
vent right there. You're
And
gonna
it
do-
looks dirty too, so
Yeah.
that's like you really said
You're
that's.
definitely
I
gonna do
can
that,
argue
yeah.
right too, it looks like it needs
Oh,
to be
yeah,
dusted
people
right
don't pay
now.
attention to them.
Yeah.
Yeah.
Cause
You're
them get
definitely
dirty,
gonna-
especially the ones
I
that be
pay
up here
attention to every single one
in the
of them.
bathroom. Sometimes you gotta
Cause they
really,
breathe.
like
That's
that
why
right
it
there, that look
bothers
dirty
me.
right there. Is that
Those are my
dirty?
pet peeves.
You're right.
Dirty
That's
right there.
trying to get it, 'cause you can see
That
that's
dirty?
from here.
It's dirty.
Yeah,
You
that's
can see it
dirty.
From here.
You can see it from here. Matt would throw a light up there.
I'll throw my
Say,
flashlight up there, let's see. Okay, so, let's see how we did, okay? Ready? Aim. Boom.
Yep.
All right.
Oh, wow, we
so-
got a lot.
We got a lot of them.
Yeah.
So the window sash there, or the Wanda.
How you clean
the-
the blue thing?
So that's the curtain. So,
That's the disposable?
Yeah, it looks like.
so that's either, again,
that's
it's making
different.
note to take a look at it, see if it's soiled, if it's got blood on it or
Then we
something.
tell Maria, and she'll have somebody come up.
Yeah, and we'll have it changed. The
Okay.
floor, all parts of the bed, to Mo's point, you know, you do clean every part of the bed. The overbed table, IV pole, that crusty vent on the wall.
No,
Yeah.
Matt, they showing us all the check marks. Why is not the check mark down there?
Yeah,
Well,
I
we
think
don't
there,
clean that,
we got 3 check marks on the bed. So
So
really, the
it's
bed
all
is
good.
entirely top to bottom.
Yeah.
Oh, okay, that's what they mean?
Look at it like-
Okay, all right.
The bed prime, the headboard, the
Yeah, the
sideboard,
bags
everything.
hanging sometimes they leak.
I mean, they'd have to
Yeah.
have 15 different
Yeah.
stickers on the bed.
Yeah, yeah.
So yeah, you guys got a lot of them, definitely. And then again, there's probably more that we should be aware of. What I always look for when I go into a room is, and you talked about walls, Becky, is where the dirt's gonna be on the walls. Look behind your sharps container, like where they throw the sharps.
I
And
know.
sometimes blood splatters on the wall right there. So always make sure you're looking at that and training people to look at that.
Mm-hmm.
All right, so, so again, these are key areas of focus. Doesn't mean it covers every single thing we clean, but it's key areas of focus are what they're showing here. Okay. And again, the reason we do a lot of those things in an empty room without the risk is because you don't have the risk of disturbing the patient.
Yes.
You know, when you're trying to do those things. All right. So remember that one of our most important responsibilities is to make sure all pathogens are removed from the room so the next occupant is not exposed to anything. Okay?
Mm-hmm.
So on page 5.1, we're going to talk a little bit about dwell time. What did we say dwell time was?
Yeah.
Yeah, but what about disinfecting? What does dwell time do for us? What is the definition of it?
I do know what it was.
Dwell
Right
time is
behind
on
the pill. Look behind the
dwell
pill.
time is how long they gotta stay on
Yeah,
how long they gotta stay on there to be
Right.
effective.
Exactly. How much time it has to stay
stay
wet?
on the surface.
Wet on the surface to kill the microorganisms or pathogens, okay? How long does it have to stay wet to kill everything? Okay? How do we use our cleaning chemicals? How do we know how to use our cleaning
The
chemicals?
instructions.
Because it's,
Right.
yeah, the
However it says to use them on the bottom,
However it says to use it on the bottom.
according to the label instructions. And then we're gonna obviously follow all of our own processes and our facility approved processes, all right? So what questions do you have on the occupied versus unoccupied patient room?
Any
None?
questions?
No.
Okay,
Um,
we're gonna watch a
we got
short
that.
video. And it's gonna show some things that could go wrong potentially in cleaning a discharge.
They can go wrong?
Yeah. So watch this video and we're gonna keep an eye out for things that are going wrong. Where are we?
We on linen? Is that linen or, dwell time?
We all.
Dwell time.
To clean a patient room, you must first select the clean.
No, 5, the one right above it. It's just worded wrong. Yeah, we found that.
Michelle is a healthcare environmental services technician who has been assigned to clean a discharged patient room. One of her many responsibilities is stripping the bed to get it ready for the next patient. What is Michelle doing wrong? And what should she be doing?
Again, our primary responsibility here is not to remove the linen, but many hospitals it is.
Oh, okay.
So I worked at Kenmore for many, many years and we stripped the beds there. We didn't make the beds there. That was the difference. We stripped them and cleaned them and then nursing made them. We just do it kind of the opposite here. So again, this is looking for things that are, it's still a technique and it's still something that's within our job description to do. We just don't happen to do it according to our service level agreements here. Look for mistakes.
Michelle touches the clean curtain with a dirty
First
hamper.
thing I see.
Ooh, where's her gloves?
Wait till the end.
She
and
moves the
we'll
two
discuss.
blankets out of the way.
You can jot them down if you want.
She quickly strips the blankets and sheets off the bed and flings them around. She continues to pile up the linen until the bed is completely stripped. Michelle picks up the dirty linen.
She got
She
that.
places it in a linen hamper.
And then you so, oops.
Make notes when you see things.
Ugh.
She picks up the linen hamper to remove the dirty linen.
She was really infected the whole thing, didn't she? She touched the curtain.
And places it on the cart.
Oh, she put it on her cart.
Michelle finished stripping the bed linen, but what went wrong?
What went wrong?
Everything. She was drinking,
Okay.
wasn't she?
So keep that in mind. Let's look at getting it right.
Michelle's going to try stripping the bed
Or
again.
attempt of getting
Pay attention to what she does differently this time.
Still ain't got no gloves.
She never-
Oh, wait a minute. We don't know yet. Calm down.
Okay.
Performing hand hygiene.
Michelle starts by putting gloves on. This protects her in case the soiled linen is contaminated. She makes her way to the bed. She takes a moment to look for any objects that may have been left behind. Michelle finds a TV remote and places it out of the way where she will wipe it down later. Linen can contain sharp objects, TV remote controls, or even patient personal effects. She now strips the bed, carefully rolling the linen in a ball. Michelle carefully holds the balled up linen away from her body to avoid the possibility of spreading contamination. She places the linen directly into a linen hamper, avoiding the privacy curtain. She's careful to make sure all linen is inside the hamper and she doesn't push down. Michelle takes the linen to the soiled room. She removes her gloves and throws them away. Michelle goes through hand hygiene procedures to keep herself and others safe. Michelle has successfully stripped the bed and has protected herself and others by following the correct guidelines.
Okay, so much less gasping the second time, right? The first time was a little scary. So what were some things you made note of that she did the first time that were kind of outright
She
scary,
didn't put on gloves, she didn't wash her hands,
right?
Proper hand hygiene.
and she came in and just grabbed every little thing and touched everything.
Yeah, anything else?
And, she even, brought the curtain along with her.
Yeah, kind of touched the curtain with the dirty
Yeah,
linen,
with the dirty
put the
linen.
dirty linen on top of her cart. She had the remote like
Yeah.
wrapped up inside the
Wrapped up
linen. She didn't
inside.
look. She just rolled it all up and,
Yeah.
pulled it all into the same pile and threw it in there. So yeah, not a very safe process, not a very mindful process, and certainly left a lot to be desired. I think she did a much better job the second time and kind of correcting and doing proper hand hygiene, making sure that she wasn't putting herself or others at risk.
So why does it matter? We gotta write that in our
Yeah.
book.
So, did you write some things down of what the technician did wrong?
Oh, okay, I'm writing it down.
Yeah, some things, you said them.
I know.
Yeah, proper hand hygiene.
Yeah, she didn't use hand hygiene. She didn't keep the linens away from her body. Yeah, she touched her face, gross.
She held the linen up to her body, did you
Yeah.
say that one?
Yeah. She put the dirty linen on top of her cart. But pretty much everything. Left the remote wrapped up in the soiled linen.
Mhm.
Okay, so why do these things matter? That's the next question. Why does this matter?
Because it's stopping the spread of infection.
If you do things the right way, it can stop or break the chain of infection, absolutely. Not allowing those microorganisms or bacteria to pass along to you and or the next person or the surface that you're cleaning, anything like that. And it's just good practice, having safe, consistent, good practice, all right? So, a little on 5.12, it just gives you some reminders. All linen should be considered contaminated. Consider it like it's.
All of it?
All the linen, all the soiled linen, we should be treating as though
It's
it's contaminated.
contaminated, okay.
Use proper body mechanics when lifting heavy objects. Ensure all elements in the room, such as the privacy curtain, are inspected as part of a discharge claim. Document or identify linen that should be removed from circulation. We do have bins up in the clean rooms that are for like wasted linen or linen that's spent, reject linen. And then we always try to make sure we're stocking our linen to our par levels on the floor. Okay. Alrighty, so on your page 5.13, there is a little scenario we're going to go through, a customer service scenario. Okay, so the person on the screen is a family member of a patient who was just discharged from the room. She tells you that a phone was left on the bed of the room you just cleaned, and she's asking if you can get the phone for them. If you can help get the phone for them. So, what questions do you have before we try to handle this situation?
I would ask what color is the phone?
Okay, so here's some options. I'm going to give you some options, all right, on what potentially we could do. So let's say the first option is you could dig through the linen hamper and see if you can find the phone. So what are the pros of this option? What's a good thing of digging through the linen to find it?
I mean, it might be in there.
You might find
in
it.
it,
So
yeah.
write that down. What are the pros of option one? You might find it. That's a pro. And you might find it quickly if it's in the hamper that you just pulled out of the room. What is the con?
I mean, get contaminated by digging in some dirty linen.
Yeah, you could get contaminated, you could get pricked by a needle, you could, anything like that. Yeah, contamination, cross-contamination, injury or illness to yourself, certainly. Okay. Option number two, you can tell the family to check with the nursing supervisor. What are the pros and cons of this? So tell the family to check with the nursing supervisor. What are the pros?
A nurse might have found it or something.
That's
Yeah.
possible. It could have been turned into the nurse already. So yeah, write that down. Could have been turned in. And it also, a possible pro is that now it's not your problem anymore.
Yeah, no, yeah.
But you haven't necessarily solved the problem for the family member either. But you've essentially just moved the problem over to somebody else. So what's a con? What's the potential downfall of this second option?
If you don't find it.
Well, I mean, you're essentially saying, oh, I told the nursing supervisor about your phone, and you walk away. So what's the con to that? What is the family member thinking?
Think you don't
They
care.
they think that you
Poor
just don't
customer
care.
service, they just blew me off. They just
Yeah.
dumped me down to somebody else and walked away. So yeah, there's a possible con is that perception of bad customer service or lack of concern. Okay, third option, you can tell the family member, you'll check with the laundry department, take their phone number and get back to them. So what are the pros for this?
Oh, we just went through that. That they might find it in the linen. That they might find
Yeah,
it.
pros are they might find it.
I just went through that.
You kind of assured the family member that you care and that you're looking into it. Yeah, at least tell them that somebody's trying, So it's good customer service, but you're also, the other pro of this is you're not digging through a dirty laundry bag.
Right.
You're getting yourself
You're giving yourself.
potentially at risk. Okay, what's the possible con? What's the con for this? What's the bad part about this?
They might not never get it back.
Yeah, and they definitely might not get it right away, right? It might take, because our laundry, even if we take it out that day, it's picked up 3:30, 4 o'clock in the afternoon, gets all the way back to Erie, Pennsylvania that night. They might go through it the next day and start to launder it. So, and chances are they're not gonna find that phone or device for a day or two. So handling it that way gives the family member some pause and some peace that you're looking at it, but it doesn't necessarily solve their problem quickly.
Last week, one of the nurses, I guess she took out her parcel and put it in some paper towel, but she ended up throwing it in the garbage by mistake. So I had just emptied the garbages, and I see her looking like going crazy. And everybody goes, so what you looking for? She's like, I have my parcel, and I think I mixed it up with the garbage, and I threw it in the garbage.
Oh,
So,
man.
and so I had just took the bag and put it, in the garbage for either gift. So I just ran out there and got it and carried it back, and she opened it, and we looked through it, and it was wrapped in some little tissue. I mean, I don't know how she found it, but it was just like,
Yeah.
And she was just so happy, but it was like,
I mean-
man, how you do that? Like, cause it was just two little teeth,
Yeah.
and it's like,
Yeah,
she
I
just
mean-
thought that was gone.
And some, again, there's pros and cons to that. The pro was, Mo, you went the extra
Yeah, I
mile,
went
you
the
took
extra
care of her,
mile.
you helped her out. She didn't have to go to the dentist to
Yeah.
get a new partial,
Yeah, she
probably
was
saved a
like-
bunch of money,
Yeah,
and was probably very thankful to you.
yeah.
The con is, we're digging through garbage.
Yeah,
We're
we
putting
Yeah,
ourselves at
yeah,
risk.
it was- we had to
All right,
put out.
so-
Even laundry, because people have done that in the laundry.
Yeah, I've
Then he
done it.
lost her whole, it was only $6, but I was like, why am I going so crazy for her $6?
Yeah.
I wanted to give it out of my pocket and give it to her
Yeah,
until I
I
found
mean-
it.
We do have the habit of going the extra mile, but we gotta kind of balance that against, the whole idea of this exercise, let's balance it on, are we putting ourselves really at risk and for something that's really not the equivalent of what the risk could mean to us, you know?
Right.
You know, I had an issue a few months ago where a patient, they wrapped their phone up in bed linens, threw it in the linen bin, and luckily the linen bin hadn't left the floor yet. It was still one of the ones up on the hallway in 7. So I went up there and they were freaking out, like, we need our phone, we need our phone. And I said, well, what's the phone number? Let's call it. And I called it, and then you could hear it buzzing inside the bin. So,
They freak out
we
about their
found
phone
Yeah, someone
sometimes.
just a week ago put
Oh,
their rings in a,
rings.
what they put in a
in a
trash
garbage
bag,
bag.
and then asking us where it is.
Yeah,
They put it in an actual bag,
in a
trash
garbage
bag.
bag.
Yeah.
Hmm.
We're like, they're panicking. Oh, our rings, or we can't find our rings. They're in a garbage bag.
Yeah.
Okay. So is
Okay.
garbage. Like, that's what we put in garbage bags, is garbage. But I don't know whatever
Yeah.
happened to that, so. But anyway, the whole idea of this exercise is really to understand, you know, what are our different options and things we've got to go through in our head as we're trying to take care of our customers. So let's say of those 3 options, option 1, dig through the trash, the linen hamper, see if you can find it. Option 2, tell the family to check with nursing soup. And option 3, tell them you'll check with the laundry department, take their phone number and get back with them. Which one of those 3 do you think is the best?
Check with the nurses.
Yeah, check with the nurse and let them get back with you.
Okay.
Because they strip the room before we go in it, really. You know what I
Right,
mean?
so they would know, they would see the objects.
Okay.
Hopefully they.
And again, the risk to you there is not, you know, having the patient or visitor or family thinking that you're not
We'll
really
take it.
caring, you're just
Trying,
passing
yeah.
them along to someone else. That's the risk. Okay, so I would say, I mean, what we're being led to here is that option 3 is actually the best choice. When you weigh risk versus customer service. You know, option 3 allows you to maintain customer service and allows you to maintain some ownership of the situation instead of just passing it off, but it also doesn't put you at risk. All
Right.
right. So here's some of the reasons why. Should never really dig through a hamper in a room or a supply closet. Again, I know we've all done it because we want to help people. That's our first inclination is to help people. But we've got to always weigh that safety factor for ourselves. Okay. Checking with the laundry department so it will be recovered when laundry is sorted. Okay. Our best chance for finding things, if you've ever been to a big commercial laundry, they have a sorting process when the laundry comes in where they it all goes onto this line and these people are in full suits with masks and everything else. And as the laundry comes down this belt, they're kind of sorting sheets, towels, gowns, sheets,
No, I never
towels,
knew
gowns,
that.
sheets, towels, gowns. So at that point, they have as good a chance of finding it there as anywhere else. So if you know it's in a gown or in a blanket, as they're sorting that blanket, they can be paying special attention to try to make sure, oh, this is one of the bins that came from Roswell. I can try and see if that foam is in the blanket. You know, again, it's still a needle in a haystack, but the sorting process is the best time to probably find things. Again, always try to address issues yourself if you can. You don't want to come off to customers like you're passing them off or you're just trying to get rid of them or just dumping them off to the side. And then follow up with the family so they feel like their request is important. You know, let them know, hey, I called the linen department. They're gonna get a call out to the plant and let us know if they find anything. And again, in all cases, be a role model. You know, be someone that folks, new people coming into this department can look up to and understand. You know, this is the right way to do things. There's a reason each of you has been selected and was selected through our interview process to be part of this program because you are role models. You do things the right way. You take care of our customers and our patients in the right way. We didn't select people for these roles that don't do that. We didn't select people that are, you know, on their last gasps for attendance or that have write-ups for work performance. Those are not the people we're putting in these leadership roles in this department.
Okay,
All right.
sounds good.
So, again, not only the fact that you are trainers, but that you're gonna have this CHEST designation. You know, that's a nationally recognized designation that you can take with you, that puts you in as sets you up as an expert in your field. All right. So be proud of that and make sure that you're setting the tone for doing things the right way. As again, most of you already do. But some takeaways from this are, you know, we should be communicating with those that we train and those that we work around, you know, communicating at a high level of why we do certain things and the fact that we do them for a reason. It's not just because we like to be nitpicky. There's scientific reasons why we do these things.
Okay.
Okay. And always being responsive and friendly to families. Okay.
Mhm.
Again, we talk about taking ownership. You know, that issue of the linen wasn't so much, some of it was an infection control discussion about digging through linen, but a big part of that is just taking ownership, you know, own the process of helping that family. You know, every one of you in here has done that at some point in your time with us here. So I don't think this is a stretch or anything unusual for you to go through or to think about being a leader and you know, making sure you're being responsive and friendly to families, because you always are every single day. Again, taking ownership of situations. Willingness to do things outside of normal cleaning in order to be helpful, okay? These are ways you can be a role model, you know? Normal cleaning is certainly every day we have to do it, but there are those things that each of you does to make, you know, maybe helpful to brighten someone's day, whether it's bringing them a card, whether it's, you know,
Used
picking
to
up
be the newspaper,
yeah,
but they don't got it anymore.
yeah, right.
They love me for the
Yeah,
newspaper.
but things like that that allow us to be helpful to the patient, allow us to be an asset to them and be a help to them. And then again, making a choice to do the right thing. You know, I don't think I have to talk to any of you about that because I think you're all try to do the right thing every day. All right,
Mhm.
so let's review.
Okay.
Name at least 3 differences. And again, if you look at page 5.16, okay?
Mhm, mhm.
And we're gonna write the answers in. Name at least 3 unique tasks performed in a discharge room. So what are things we do in an unoccupied or discharge room? 3 things.
High dust.
High dust, number 1.
Dust mop?
Well, we dust mop in an occupied room too.
Oh, yeah, oh, that we do in there.
Clean the mattress.
Yeah,
Oh,
three
yeah,
differences.
clean the mattress.
Clean the mattress, yeah.
Yeah. But not fine.
And what else in a discharge room?
Light fixtures.
Yeah, any of your high dusting and things up high.
Television? Well, but like,
Television, I mean, that's part of your high dusting. What about that? I mean, after you clean the mattress, what do?
oh yeah, do we make a
Make a
Right,
bed?
make the bed. We don't do that in an occupied room.
Yeah.
Well, Becky lets them make it.
Yes, I do. I'm gonna stop it. I'm stopping that. Well, I got no choice. I don't feel well.
They should be doing.
I'm
They
using
know,
that as
they
an
know,
excuse.
they know they should.
I know that.
Okay, so why do you carry linen away from your body?
So you don't get infected, or you don't get hit with no needles or anything.
Yeah, so you don't contaminate yourself.
Yeah.
Don't contaminate yourself and avoid injury.
And avoid injury?
Yeah. Okay,
Okay.
what is the proper way to clean a mattress?
Top to the bottom.
Oh, did I skip one? Oh, I did skip one. Name a high touch area in a room. So what's a high touch area?
They're over there, behind you. They're straight against the back wall, yep, under green.
The railings,
Well, they're tight,
the
like,
bed,
they're-
the doorknobs.
Yeah, what's the high touch
fixtures,
Yeah.
area?
the sink, the toilet.
Yeah.
everything.
Yeah,
I think people put their grubby mitts on.
hands touch. Everything hands touch.
Yeah. Okay, now what is the proper way to clean a mattress?
From the top to the bottom.
Okay, I do. I don't go in
Top off and then-
I do go in a circular motion when I'm cleaning the bed. I don't know why.
You should go one direction.
I know,
Unilateral.
I know, you just said
I
that.
mean, back and forth is still one direction. I'm not saying go like this.
Oh.
Stop,
and go
like
back.
that.
Oh, that's what I thought you were saying,
Yeah.
okay.
Stop.
No, then I'm
You
doing
can go
it
back
right.
and forth.
Okay,
You're
yeah,
not
I'm
supposed
going
to go in
back and
circles.
forth. Yeah, okay.
So unilateral, same direction. What about, how do you handle the top and the bottom of the bed? How do you handle cleaning the top and the bottom? Top of the mattress and the bottom of the mattress? How do you clean it?
Oh,
You
I
can't clean it without.
white.
Yeah,
Yeah,
flip it up.
yeah, flip
Yeah,
it.
so you clean the top and flip it up and clean the bottom and then go to the bottom. The best way is clean the top of the mattress, flip it, clean the bottom and the sides, go to
You
the
gotta clean it.
bottom.
No, you can't flip it till you clean both sides, because then you're flipping on, clean on the dirty. If you
Yeah,
flip it, you gotta
clean
clean the
the
whole
mattress
side of the
Yes,
mattress
right.
and then go over to the other side,
Side
clean the
and
whole
do the
side.
whole
Yeah.
side
Yeah, because
again.
if you clean the
So
top and
Are
flip
they
it, you're flipping.
considering the half the top and the
Yeah.
other half the bottom?
Yeah, because if you flip a clean part over onto the dirty part, you're cross-contaminating.
Yes.
So you have to clean the whole
So you have
thing
to
from
clean
the
the whole
The
side,
whole
yeah.
top and then flip and then
Yeah.
do each part of the bottom.
Yeah,
Right.
I did that. I put it on a table that was
We
dirty, a
should word
pillow.
this. We should
Yeah.
And I had to
But yeah,
re-clean the
You
pillow.
gotta clean the whole
We
mattress.
should
before
Okay,
you
so
flip it.
clean the
word
top.
this better.
Yeah,
Top
well,
of the
I think what they see is you clean the whole left side,
It says
And then
clean it
flip.
one half at a time.
yeah,
with a disinfectant.
side, left and right, not top and bottom. That's what they're talking about.
Oh, left and right. Okay.
But if you clean the whole left side and you flip it and clean it, you're not cross-contaminating.
Left.
And then you go over to the right side and you're not. But if you clean the top and you flip it, you're
You
cross-contaminating.
probably, because
So
the
you're
bottom
doing the top
hasn't been
going on the
cleaned
bottom.
yet. Right.
Right, but if you clean the entire top,
And
The
then,
entire
flip
left
it.
side,
and
not
then flip.
necessarily, yeah.
Okay.
Then I go to the bottom with this, but the top is already done.
Okay,
That's just how I do it.
so where do you put soiled linens?
Yeah.
That's, yeah, it's not a trick question. And the soil linen hamper, yeah, and soil linen container, very, very simple. You don't put it in the garbage can, you don't put it in the bathtub, you don't put it in your cart. Soil linen hamper. Okay, several ways in which you are a role model. What are several ways in which you are a role model?
Performance.
Yeah,
Doing my job.
doing your job the right way. Being safe, yeah. And fast?
Yeah.
Yeah, fast isn't always, I mean,
Yeah.
you wanna be productive and you wanna move along, but don't go too fast, so you're
Yeah.
missing things. But yeah, definitely always work safely, definitely follow what?
Procedure.
Follow the cleaning process, yeah, okay, follow a process, do things the right way. Okay, take care of our families and patients at all
Mhm.
costs, that's what we're here to do. Doing the ethical thing, helping them find something lost or turning in things that you find. Okay? All right. So that is the end of session 5. Nice work. We finished a
Isolation
touch
rooms.
early, but we're not much on and trying to take 6 or just call it.
Oh, 6 isn't that like an hour and a half?
6
Is
is
it an hour?
20, 40, 60, yeah, it's almost, it's 2 hours.
2 hours,
We're not gonna do it
yeah.
Okay, so we'll jump into section 6 tomorrow, okay? A good amount of section 6 is about isolation rooms. okay?
Yes.
And isolation rooms, again, we've talked about a lot of the things having to do with isolations.
Mm-hmm.
What we do, how we don and doff and all that kind of thing. So some of that will be a review, but there's also gonna be some things that are very specific to isolations and about breaking the chain of infection. Some of it will be repetitive though, all right? Then we'll do module 7, which is the occupied patient room, number 2, okay? There's another,
Every 2 hours.
yeah.
6, 7, and 8 are 2 hours.
Yep, and then we'll do number 8. So that's gonna be our tomorrow, 6, 7, and 8. Section 8 is, I think, common areas. Yeah,
Okay.
common areas, which is kind of how to clean and disinfect things in kind of common and public areas. Okay,
Alrighty.
and then things like carpets and some advanced floor cleaning, privacy and HIPAA, equipment safety, those type of things. So those are the 3 sections we'll get through tomorrow. And then Thursday, to wrap everything up, we will get through modules 9, 10, and 11. 9 is specialty areas and uncommon situations. 10 is a review challenge, okay?
Mhm.
And there's a game we're gonna play for quite a bit of time.
Okay,
The game is fun.
okay.
And then 11 is really just pop-up
pop-up.
practice,
Oh,
okay? So, we'll get through that in no time on Thursday. I know that Thursday might not even take us the full day. We'll see how Thursday goes. But, yeah, and then we'll be done. I'll get all your stuff, all your registration stuff into the AHE, and we'll try to set up a date in the next, I don't like to wait more than a week or two before we do the exam, because I like to be fresh in your minds. All right?
But
So-
they give me time to study.
Yeah, but you're gonna know all this stuff. You're gonna know it all by the time we
I'm
get
still
there.
studying.
I know, but you're gonna know it all, and it's not gonna be something that's a super complex for you. You're gonna know all this
You've been
stuff.
up,
I
I
got
know
it.
you've been up on that foot.
So what do you guys think of the program so far?
I like it.
It's different.
So it gives us a chance to dig into some of the details, you know? You're probably learning some things, probably some things
Yeah.
you're saying,
I'm learning how to talk to people now,
well,
instead of just saying, okay, okay. Now I can say, it's not good for my interest.
Hey, guys, your question,
well,
We can
they're
say
good for the
stuff.
patients, they're good for safety, you know?
Yeah.
Mhm.
was like, was like the range supposed to be over a 2-year period for this?
What are you talking about?
Like, when we got the position, and you said
Supposed to
the
get a
pay go
raise.
up, did it all go up at one time, or did it supposed to go up over like 2
It already
years?
went up. It went up
Okay.
the second you got put into your new,
July.
new
Oh,
role.
but I thought you said it was gonna go up like over 2 years, like 1 year was gonna go up and then the next year or something.
No, I didn't say that.
Oh, I'm sorry.
Yeah.
Oh, because I mean, essentially,
tried.
each year that you get a step,
Oh.
your amount goes up. So your steps will now be steps at the new grade. So now each of your steps will be whatever the step is at
Oh.
grade 6
Okay,
instead of
what's,
being at grade
what's the
4.
maximum this go up to?
I don't know, I'd have to look at the contract. And they're in the midst of negotiating a new contract,
Yeah. no.
so those dollar amounts might not even be accurate. But I could look at what it
All right,
says
I
in
was
there
just
now.
looking.
I think the current contract ran out almost a year ago.
Yeah, it did.
So
Yeah.
I don't really know what the new steps are gonna look like. But yeah, it's a grade 6, and you guys all went to the grade 6 the second that they switched you to the
Yeah, I
new
see.
role.
All right.
All right?
Yeah, I just gotta do my evaluation.
Okay. Well, thanks for your time today, folks. Appreciate you. And we got through this in pretty short order today, not too bad. And we'll reconvene tomorrow.
And don't forget, we're in CSC tomorrow.
We're in CSC on the 7th floor,
What
the
else?
Clinical Science Center, over where like
You
chemo and,
know the building I work in, when you come in, you leave out through the lobby, you see me down in that lobby.
Seventh
floor, you
CSC
said?
building. You know, when you be going out,
Oh, when I go out on
when you see
Michigan,
me, yeah, when you see me, yeah.
up them elevators.
Yeah, that's the CSC
Seventh.
building.
Seventh floor.
Seventh floor.
Yep.
Can we get by there without?
Is it called
we ain't
conference
gotta
room?
scan?
It's right across from the elevator. When you get off the elevator.
One of us
Oh,
will
we've
be
been
there.
in
We'll
there
make sure you
before,
get
right?
it. We'll make sure you get
So
it.
for the next 2 days, it's gonna be
No,
up there?
Just
just tomorrow.
Oh, okay.
We just couldn't get one of these rooms tomorrow.
Yeah.
You know, it does say
And then-
P701 conference room.
Yeah,
but-
that's it.
Yeah.
That's the room.
Yeah.
And then Thursday, we'll be back across the hall here.
Okay, Thursday, back across the hall?
Thank you, everybody.
Well, I guess these are used phones.
Bob said something about a curtain. Oh, good. Oh, You too. You know what?
Okay.